So go ahead and put your name on them, write on them. Right now when we're going over the teeth, you can, yeah, you guys can take those home so you can study on them. So again, here we're jumping to lecture number 4. Again, this is where we go a little bit out of order in our class. We skip the radiology because I think it makes a little bit more sense to talk about the teeth before we start taking x-ray on the teeth. So anyway, teeth, there's different types of teeth. Again, and as humans, we are omnivores, which means that we eat both meat and plants. Most of us, some of us don't. But to accommodate this diet, we have different teeth that are specific for certain types of food. Some you cut, some you grind, some you shear. Okay, so the different teeth are shaped differently to do this job in order that you can break down the food and start getting the nutrients out. So the incisors, okay, your incisors are your front teeth. Okay, they're single rooted, meaning they only have one root most of the time. Every now and then you get a mutated tooth that has, it's a front tooth and it's got split roots, but 99.9% of the time they're single rooted, meaning it's got one root. And that's important. Located in the front of the mouth and designed to cut food. Okay, so on these teeth, they're going to be probably matching, and it'll have incisors, and on this side it'll have the definitions of all the teeth, and you'll have to draw lines or match them. Okay, so you need to know what the incisors are. They look like this. So again, the incisors are your front 4 teeth. Okay, not your canines. Your canines are your eye teeth. Your front 4 teeth are incisors on top, and then your bottom front 4 teeth are lower incisors. Okay. Then you have the 2 middle ones are called centrals because they're in the center, and then the 2, one on each side of each central is the lateral incisors. So they're central incisors, lateral incisors. So again, this is looking at it from the front, this is looking at it from the back, or the lingual. Labial meaning lip, lingual meaning tongue. This is looking at it straight down from the edge. It's called the incisal because you incise food. Okay. This is looking at it from the mesial or towards the middle, and this is looking at it from the distal or from the back or from the furthest from the middle. And then you've got again the lateral incisors, which look like the centrals, but they're a little bit smaller. Okay, so you get central incisors, lateral incisors, single rooted in the front of the mouth. And that's what the question is. Okay. Single rooted front of the mouth. Which tooth? Incisors. There they are. Okay. Front 4. Front 4 are incisors. Okay, then you have centrals and laterals. So they have kind of the same shape, but the laterals are a little bit smaller. Lateral meaning just off to the side. Okay, this is the midline. This is the center, the midline. So mesial. This is mesial because it's towards the middle. This is mesial because it's toward the middle. This is distal because it's away from the middle. Okay, we'll get to those right now. Middle, this is the midline, so this is mesial. This is the mesial side of the central, this is the mesial side of the central. This is the distal side of the central because it's distal, it's got distance away from the middle. Okay, canine, also known as a cuspid or the eye tooth. People say, well, I broke my eye tooth or I chipped my eye tooth. Or it's the canine because, I don't know, for dogs. Eye teeth. Okay. Again, it's a single rooted tooth. You get 99.9% of the time. It's in the corner of the arch, designed for tearing and cutting food. It has the longest root of the human teeth. It is also the most stable tooth in the mouth and usually last to be lost. That's the test question. It has the longest root of the human teeth, and it's the most stable. It's also in the front of the mouth, but it's not the incisor, it's your canine. And when you build an arch, like if this were an arch, the strongest stone is your cornerstone, okay? And that's why your canines, they're in the corner of the arch, so they're the strongest teeth, because they're the cornerstone of the arch there. Okay, so they're usually the longest, two, here and here, and on the bottom here and here. Okay, so you've got 4 canines. You've got one on each corner, 2 upper canines and 2 lower canines. Okay. So here are your canines. Here, 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 and here. And these guys are what? Incisors. Incisors.
We can't call those silent vampire teeth anymore.
You can't call them vampire, no. Not in the dental office, they don't call them vampire teeth. Call them eye teeth, you broke your eye tooth, not your vampire tooth.
Because my dad and all of my sisters ours all look like vampire teeth.
Vampire teeth.
So we call them our vampire teeth.
Yeah.
Thanks, Dad, for giving me
Yeah.
great vampire teeth.
Okay, so the other name for a canine was a cuspid. Cusp. A cusp is the tip of a mountain, the cusp of a mountain, or the cusp of a hill, or so the canine is a cuspid. It's got 1. Premolars, which are the ones right behind the cuspid. Okay, these guys, they're bicuspid. Okay, meaning they have 2 cusps. Okay, the cuspid has 1, the bicuspid has 2. Okay, so the cuspid only has 1 point. Okay, this is the cuspid, the canine, So the canine only has 1 point, meaning it has 1 cusp. The bicuspid has 2 points, meaning it's got 2 cusps, right? So it's got 2. And you can see you've got 2 bicuspids on each side. Okay, so you've got 1 cusp on the canine, 1 tip, and you've got 2 cusps on the bicuspids. Okay, you guys understand the cusp, what the cusp is?
Yes.
Okay, so also known as bicuspid, that's on the test. Which is what's another name for a premolar? Bicuspid. Have cusps for grasping and tearing food, and somewhat broad surface for grinding food. As you go back in the arch, the teeth get broader. You get more surface area because you do more grinding in the back teeth. Okay, so you start getting more size. And usually you bite with your front teeth, you incise with your front teeth, and then you throw everything to the back and you grind things up. Okay, again, that's what teeth are designed to do. So you can't put an incisor in the back when you do too much good chewing. Okay, that's why you got molars in the back, to grind things up. And your incisors, you incise your in and out burger, and then you throw it back and you grind it. Okay, so again, bicuspids or premolars. This is looking at it from the buccal or the cheek side, from the lingual or the tongue side. Again, you've got cusps on this side, cusps on that side. 2 cusps, 1 cusp tip, 2 cusp tips. And then this is looking at it from the distal or the back side. And these are 2 roots. Lower ones usually have 1 root, but upper first usually have 2 roots. That you don't have to worry about for premolars. But know that they're called bicuspids, and they're for grasping and tearing. And these are the lowers. Okay, again, have 2 cusps. And on the lower one, you start to get 3 cusps. It starts to form a 3rd cusp sometimes. Okay, questions on premolars. They're right behind the cuspid. So you got cuspid, bicuspids, and then your molars. Okay, so here's your canine, and here are your 2 premolars or bicuspids. Okay, so you got central incisor, lateral incisor, canine or cuspid, and bicuspids or premolar. Okay, then you get your molars, and obviously these are the major workhorses. Have more cusps than the other teeth in the mouth. Broad and short cusps translate into a wider chewing surface used for grinding of masses of food. And that's the test question. Which tooth has the broader surface area, molar or premolar? Molar is used for grinding hard masses of food. Okay, again, the further you go back, the broader the tooth gets. Every now and then you'll get a deformed tooth or a malformed tooth, and it'll be just like a little shriveled tooth, but usually the further you go back, the bigger the tooth gets. Okay, so again, here's your premolar or bicuspid, and again, you'll see your molar much bigger. And molars will have 1, 2, 3, 4 cusps, or sometimes 5 cusps. Sometimes you'll get a side cusp here on an upper. Okay. Questions on molars? Broader for grinding.
How many roots do the molars have?
We'll get to that. Good question. Okay, so upper has 3 roots. Okay, upper molars will have 3 roots. This is upside down. Okay, you've got the palatal that goes into the palate, into the roof of your mouth, and then you've got the buccal roots, which are on the outside. So kind of looks like this. Okay, and then just looking at it from the lingual, and here's the palatal root, the big fat one, and then you've got 2 buccal roots on the cheek side. This is looking at it from the mesial or the front. You've got the palatal root, and then you've got 2 buccal ones. Or actually, yeah, and then here's the palatal root, and then 2 buccal ones. So this is the palatal, this is the buccal. Okay, the lower ones are bifurcated, meaning they have 2 roots. Okay, so upper ones have 3, trifurcated, 3 roots. Lower ones are bi. We'll get into bifurcations and trifurcations later, but upper ones have 3, lower ones have 2. And this is important because when you start mounting the x-rays, that's one of the things that you're going to look for to know which ones are upper and which ones are lower. You're going to look for the roots. How many roots do I see? 2 or 3. And you'll flip it upside down or flip it the other way. Okay, so this afternoon, that's one of the things you're going to look for is how to mount the teeth, how to mount the x-rays, and you're going to look at how many roots do I see. Sometimes things look alike. Look at the crown and they look alike. Well, what else can I look at? Look at the teeth. Does it have 2 roots? Does it have 3 roots? And you flip it over. All right, questions on the teeth themselves. Incisors are where? Front. Canines,
Next to the
your corner teeth. Bicuspids, premolars, good. And then your molars. Okay, and how many teeth total do we have usually in adults? 32, good. Unless you've had teeth taken out for braces or your wisdom teeth out. Alright, so teeth are arranged in 2 arches, upper arch or lower arch usually we'll call it, or maxillary is upper, mandibular, because of the mandible, is lower. Okay? So mandibular arch is the lower arch, which is the movable. Okay? That's the only part of your head that moves. Your mandible. Everything else, all the other bones are stuck together. Your jaw, your lower jaw is the only bone, and we'll talk about when we get to the bones of the head and neck. This is the only bone that moves. So the mandibular, lower arch. And then you have maxillary or upper arch. And that one does not move. That's part of your skull. Okay? Upper, lower, maxillary, mandibular. So when we're telling an assistant or we're delegating to an assistant what they can do, we can tell them, can you go take an upper impression for me? Can you go take a maxillary impression? Same thing. Okay, go take a lower impression, go take a mandibular impression. Okay? bring your teeth together, that's your occlusion. How do they occlude? So these teeth right now are in occlusion. They're in maximum occlusion, meaning all the teeth are hitting as close as they can. You can't force them any closer. Okay, so this is a closed occlusion. That would be like an open bite or an open occlusion. Okay, so that's occlusion. And occlusion, like we talked about, the incisal edge of your front teeth. On your back teeth, you talked about the occlusal, which is the biting surface. Okay, we'll get to that. But incisal is the biting of front teeth. Occlusal is the biting surface of back teeth. We'll talk about right now. So the occlusion is when they're in maximum contact, okay, during function. So you're chewing. All right, questions there? Again, a lot of info here, a lot of info. Okay, quadrants and sextants. Okay, I need to get my drawing board here because it gets a little crazy. So quadrants, what does that mean?
How many teeth are broken into different sections?
The mouth. So, not the teeth. So if I'm telling you there's 4 quadrants, how many quadrants is there?
4. I was like, is this a trick question?
Right. So quadrants means the mouth is broken or separated into 4. So,
4 quarters.
huh?
4 quarters, too.
4 quarters. So I'm not a real good drawer, so don't make fun of me. That's my wife. My wife's a good drawer, I don't. I don't draw too good. Alright, so if you're breaking the... This doesn't erase too good either. And if they're sextants, then the mouth is divided up into how many? 6. Okay, so the mouth can be divided up into quarters, quadrants, or sextants. Okay, midline. We talked about the midline, right down the middle. Okay, there's an imaginary line right down the middle of your face, right down the middle of your teeth. So right between the 2 centrals is your midline. Orthodontists, what do orthodontists do? Guide,
The teeth is aligned. The right
or set what? They set what?
the occlusion.
They set the occlusion, yeah. So orthodontists, they put braces, they deal with the midline of patients, they want the teeth to be aligned. Okay, so there's an imaginary midline that goes right down the middle, and we pay attention when we do crowns or bridges or anything down the middle. We want that midline right down the middle of the face. Doesn't always happen right down the middle, but we try to. Again, you want mirrored halves. Quadrants, again, each arch has 2 quadrants because you have your upper arch, upper right, upper left. Okay, and then you have the lower right, lower left. Okay, so if you draw a line right down the middle here, then you've got 4 quadrants, right? Upper right, upper left, lower right, lower left. That's how you divide the teeth into quadrants, right down the middle. Okay? Maxillary right, maxillary left, mandibular right, mandibular left. Okay, quadrants are easy. And usually that's what we do, quadrants. Okay, so there's your line, and this again, this is in the back of your this is one of your copies in the back of your folder, back pages there towards the back. I think it should be.
Yeah,
Okay.
there is.
Okay, so the midline, then you have upper, right, left, So those are your quadrants, pretty straightforward. Okay, this is another one, I think, like the one Dr. Cervantes gave you. Again, same thing, you divide it into quadrants. Baby teeth as well, you do the same thing. You divide them into quadrants, upper right, upper left. So it's not how many teeth, it's just the mouth is divided into 4. When we do scalings or deep cleanings on a patient, we do it by quadrants. We're doing 2 quadrants today. Upper right, lower right, or we're doing the upper right and upper left. Okay, so things we're doing. Now it gets a little tricky when we do sextants. So sextants means that we're dividing the teeth or the mouth into 6 parts. Okay. So the dentition is sometimes divided into 6 parts. Maxillary right posterior, maxillary left posterior, and maxillary anterior. Okay, so you've got maxillary posterior, maxillary left posterior, and maxillary anterior. And then same thing for the bottom. Okay, so you divide it up into 6. So you don't just have upper right, upper left, lower right, lower left. You have upper right, upper left, upper anterior. Lower right, lower left, lower anterior. Okay. We, as general dentists, I don't use this too much, but if you go to another office, they may say we're doing the anterior sextant, or we're doing the upper right sextant. Okay. Now, where it gets tricky is how you divide it up. Okay, because the posterior. The upper right posterior section goes from the most distal or the furthest back molar on that side to the canine. So it includes the canine. Okay, so maxillary right goes from here all the way to the canine. And on the other side it goes from the most distal tooth all the way to the canine. Okay? And the other, on the anterior, the canine, it goes from canine to canine. So the canine is actually part of the upper right posterior, but it's also part of the maxillary anterior. Okay, so if we're doing the maxillary right sextant, we're going from here to here. Patient is coming and we're doing these. If the patient is coming and we're doing the maxillary anterior section, we're going from canine to canine. So the canine gets kind of overlapped. Does that make sense? So it's divided up into 6, upper right, upper left, and anterior. And then lower right, lower left, and anterior. Whereas the quadrant is just upper right, upper left, lower right, lower left. Clear as mud? The way the questions on the exam are is, what tooth is in the upper right sextant? Okay, the question will be, what tooth is in the upper right sextant? And again, teeth are numbered, and these you should know like the back of your hand. Teeth are numbered starting with the number 1. The most furthest on the upper right is number 1. Okay, goes 1, 8, 9, all the way to 16. So on the right, 1 to 16. And then on the lower, you just drop straight down. 16, 17, and then go all the way back to 32. Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 16. You drop straight down, 17, all the way to 32. See? I got some blank stares here. So put 1 over here, 16 over here, and put 17 over here, and 32 over. So 1 is on the upper right, very back one. And 16 is on the upper left, very back one.
And then 7.
Yep, and then 17, yeah, lower left, yeah. So 17 is this one, and 32 is the wisdom tooth on the other side. And so and then you can just number them all the way across. 8 and 9 are good ones to know right off the bat. 8 and 9 are the two center ones in the front. And then 24, 25, two centrals on the lower front.
What did you say the last?
24, 25.
24.
Yeah, so 24 is on the left, on your right side. So it's the patient's left, 24, and then 25 is on the patient's right side.
So if you're looking at it.
Yeah, so 20, again, you're coming from 17, so 24 is gonna be this one, 25 is this one. So with time, you should be able to, if I tell you tooth number 3 is up here, tooth number 24 is here, tooth number 32 here, I mean, you should be able to know them right off the bat. Anyway, the question will be is, what tooth is in the upper right sextant? Tooth number 24, tooth number 17, tooth number 3, tooth number 14. And you pick which one it is, tooth number 3. Which tooth, now, the other thing is in baby teeth, well, we'll get to baby teeth. Baby teeth are lettered A, B, C, D, E, F, G, H, I, J, and then K, L, M, N, O, P, Q, R, S, T. Okay, so A through T are baby teeth, and we'll go over those. Okay, so anterior versus posterior makes sense. Anterior front teeth, posterior back teeth. So incisors and canines are anterior. And this is important when you start charting, because you can't chart if we're doing a filling on a tooth number 6. It's actually considered in the posterior sextant, but when you bill it out, it's an anterior tooth. So you can't bill it as a posterior tooth, or the insurance won't pay it. So it's got to be an anterior tooth code, and we'll get to codes later. But anterior teeth are considered canine to canine. Okay, so those are your anteriors. Posterior are premolars back. So if we need all your posterior teeth taken out, you're taking all the premolars back. You're leaving your front 6. Okay. Again, here it is broken up into sextants, or I'm sorry, anterior, posterior. Okay, tooth surface, and I've kind of said these a little bit as trying to, the more you hear it, the more it'll stick to you. But facial is the side of the tooth that's towards your face, right? So your anterior teeth, you have the facial surface of the tooth, refers to the area towards the face. So your central incisor, the part that you can see, that's the facial surface. The part on the tongue side is the lingual surface, or the facial surface. Again, you can also call it the labial, because it's on the closest to the lip. So the facial surface or the labial surface is the same. On the back teeth, the facial surface is the buccal surface, because it's the cheek side. So it's closest to the cheek. So on back teeth, on your molars or premolars, the buccal surface is the facial. On the anterior teeth, the labial surface is the facial surface. So again, this is all buccal, this is all labial. Labial in Spanish is lip. Okay, so labial, buccal. It's the same, it's just the side of the tooth that's closest to the face. We talked a little bit about the masticatory or the chewing surface, okay? On the front teeth, incisors, you incise. So the chewing surface is the incisal surface. The chewing surface is the incisal surface of the front teeth. And again, the back teeth, where you occlude, where you together is called the occlusal surface, is the chewing surface. Okay, so this, the edge of your front teeth is the incisal edge. I broke my incisor, and they break the incisal edge. The back teeth is called the occlusal, is the biting surface. Occlusal. Okay? And that chart that Dr. Cervantes gave you has those as well. Lingual is the tongue surface of the teeth. Mesial is the what? Towards the middle. Okay, so you have a tooth and the middle is over here. This is the mesial part. And distal, if this is the middle, you have a tooth, this is the distal part. So distal is distance away from the middle. Proximal is the side of the teeth that are closest to each other. Okay, so the proximal surface of a tooth faces the proximal surface of another tooth. Okay, so the mesial and the mesial of the central incisors are proximal because they're in proximity to each other. Okay, so that's the proximal surface of a tooth facing the adjacent tooth. So if I have a tooth, let's see, that's dry erase. So if you have a tooth here and the tooth next to it, this area here are the proximal area. That's the proximal contact. Okay, so where they come together, this is the proximal contact right here, right where they join. Okay, so those two teeth, this area right here is the proximal surface. So on one tooth it would be the mesial. Oops. This tooth it would be, if the middle is over here, this would be the distal, this would be the mesial of that tooth. But that area is the proximal surface of each tooth. Okay, so interproximal space is the area between the adjacent tooth surfaces. Okay, so interproximal space, this is the proximal surface, that's the proximal surface, this is the interproximal space between the two surfaces. Okay, and this you guys should have in there in the back of your. Again, occlusal is the biting surface, or the chewing. Masticatory is the biting surface or the chewing surface of the back teeth, is the occlusal. The chewing surface of incisors is the incisal surface. Then you've got the facial side of molars and premolars is the labial side, or the buccal side. And then you've got the tongue side or the lingual side. So this you have in your. That gets a little confusing there, but just make flashcards, but put something on them this time. Don't leave them blank. You make flashcards and you leave them blank, they don't work.
I have some stuff on the
Kidding.
lower
I'm
ones.
kidding. All right, so that's the easiest way to learn these. Okay, and again, as we do the charting right now, you're going to hear again those words, and they'll stick a little bit better. Although by next Friday you won't remember. And again, it's just repetition and hearing them, and they'll get just a totally different language. I mean, it's the stuff you got to keep hearing and hearing. I know it's confusing and a lot, but it'll slowly come to you. All right, division. Okay, so the teeth. Anybody need a break? No, good. Okay. Division into thirds. Okay, so the tooth, the root of the tooth, we're talking about the root only, so you can't see it on these guys because the root is up inside. Okay, this is the crap, oops. Sorry. painted here. I'll have to deep paint. This is, see, oh, you new models here. Well, we'll try to clean him up. He needs the cleaning. Okay, so 8
Quadrant.
per quadrant, yeah. Well, we need the upper right sextant there because we got the canine. So the root of the tooth, apical third. Apical means the end of the root. Okay, whether it's on top, we have a tooth. This is your canine. Okay, and here is your lower canine. You have a nerve in here. You've got a nerve on the canine. The apex is the end, or the tip, where it exits. Okay, the apex is the tip of the root. Okay, so it's got an apex here, and on the lower, the apex is over here. Okay? So the apical third of the root is obviously, if you divided the root, which is, okay, this is the crown, this is the enamel right here. So this is the root, this is the root. Okay, so if you divide the root into thirds, this is the apical third, because it's closest to the apex. Okay, makes sense? On the bottom, this will be the apical third, closest to the apex. Then you have the middle third. So you have the apical third, then you have the middle third, and then you have the cervical third. Closest to the cervix, another name for cervix is the clinic, or the, what is it? Yeah, the cervix. So that is the most narrow part of the tooth is the cervix, or the neck of the tooth. And the molars come in, they get thin, and then you have the crown. So the narrowest, or the neck of the tooth, is the cervical third. That makes sense? Apical, what's closest to the apex, then you have middle, and then you have the cervical third. Okay? So again, same, here it is. Here's the root of the tooth. You have cervical, middle, apical. Okay, now if we're looking at the occlusal cervical division, so we're looking at the top, you have the occlusal third, which is closest to the what? Where's the occlusal surface? Is the biting surface, right? Then you have middle third again, and then you have cervical third again. Okay, so here we're looking at the crown. Okay, so you have the occlusal third, middle third, cervical third. That's why it's called occlusal cervical, going from the occlusal down to the cervical. You just kind of divide that word up. I don't know why they come up with these big words instead of, that's what it is. Occlusal, middle, cervical, and then this is just looking at it from the side, from the buccal, and just looking at it from the mesial side. What would this part be on the root? Huh? Apical. Okay, now mesial-distal, what are we going to see? Going from one side of the tooth to what side? Well, mesial-distal, so we're going from the front to back. From mesial-distal. Okay, so you've got the mesial third, middle third, distal third. Okay, so you're just cutting a molar. You're looking at a tooth straight down here. This is the occlusal surface. You got the mesial third, middle third, distal third. So mesiodistal, you're going from the mesial to the distal. Buccolingual, we're just sectioning the tooth into different pieces just so you can learn the sides of the teeth. So buccolingual, we're going from which side?
The cheek.
From the cheek, good, to
Um,
lingual, to the tongue. So we're dividing the tooth from cheek towards the tongue. So you've got the facial or buccal, middle third, and lingual third. So middle is always in there. It's just which way you're going that decides what you use. Okay, so buccal, middle, lingual. And then you got mesial, middle, distal. Yep. Sorta? Kinda? Getting there? That's good. At least we're going in the right direction. Alright, tooth numbers. So, again, I know that gets a little bit of confusing. Definitely know the root portions, apical third, middle third, cervical third. Know the crown portions, occlusal, middle, cervical third. Okay? I don't know if there's anything on the buccal or the occlusal, but definitely the root surface and the crown surface. Know how they're broken up into thirds. Those are important. Okay, again, tooth numbers. We talked about it 1 through 32. Starting 1 to 16, 17 to 32. This was charted in here. Primary or deciduous means that it's a tooth, a baby tooth that's lost, that has a tooth following it. Okay, there's 20 teeth total, usually, and they're named A through T. Now this is on the test. There are no premolars and there are no wisdom teeth. That's the difference between adult teeth and baby teeth. Okay, in baby teeth you go from centrals, laterals, canines, and then they have a first molar and second molar. They have no premolars. Okay, and they do not get wisdom teeth. Okay, as an adult you get wisdom teeth. So you get centrals, laterals, canines, and 2 molars for the baby teeth. There's no premolars, there's no wisdom teeth. That's on the test. And I assure you somebody's gonna get it wrong. Prove me wrong. Everybody always gets it wrong. Not everybody. Somebody.
Okay, no.
Alright, okay, so that you guys have that for baby teeth as well. So no baby teeth, or no premolars, no wisdom teeth. Okay, let's take a 5-minute break. Do some jumping jacks and get some more Starbucks.